Welcome. My name is Prof Stuart Ralston. I'm Chairman of the Board of Trustees of the Paget Association. And today it's my pleasure to welcome Diana Wilkinson, who is a specialist nurse of the Paget Association. Now, this video presentation is one of a series we're doing to mark Paget's Awareness Day 2023. And this is an important awareness day because it marks the 50th anniversary of the association. Now, our theme this year is to look at Pagets from a patient perspective. We've got some patient interviews and to reflect upon what the association has done in terms of supporting people with disease, raising awareness and funding research, since the association was established. Okay, Diana, thank you for joining us today.
Welcome.
Okay. Diana, as you know, an important aim of the association is to provide patients and healthcare professionals with information. Maybe you could explain, how exactly we do that.
Okay, well, I'm responsible for ensuring that the association has information about Paget's disease, about its treatment, about its complications, and that it's available to whoever needs it in whatever format they need it in. Everyone who contacts us gets a free information booklet about the facts. And they can have it by post or email. They're also available for clinicians to give out in clinics. And anyone who joins as a member of the Paget's Association gets an information pack. So that contains our booklets, lots of leaflets, information and newsletters, so they've got as much information as possible. And whilst I do most of the writing for it, the content is obviously approved and checked by trustees such as yourself, who are experts in Paget's disease before it's finalised.
Diana, that's fantastic. And may I congratulate you on the props you've got behind you, showing all of the booklets of the Paget's Association. Okay, so I can see a few in the background. I mean, how many does the association have? How many have you written? And what sort of things do they cover?
Well, there's 5 main booklets. There's the one I've shown you on the basic facts. There's one about pain. There's investigations. There's one for healthcare professionals. And because our jargon buster, when we printed it in the magazine, it was so popular, I've just had that turned into a booklet as well, so that all new members can benefit from it. In fact, some of our fact sheets are things that have been printed in the newsletter that everyone can benefit from. We've also got leaflets about research and basic leaflets that help people understand the skeleton and the bone. We've even got leaflets about medieval skeletons. So we try to give people as much information as possible. We've also got a passport. So this was something that was requested by the clinicians in Southampton. And they wanted a place where people could record their tests and things. So anyone can suggest a topic or a piece of information and we'll do our best to provide it.
Thank you so much, Diana. So I was going to ask, well, how do you decide on the topics? But you've actually explained that, is through feedback from the magazine, for example, and maybe, I guess, on the helpline. In fact, talking about that, how else do you support patients with the disease?
We have a confidential helpline, so it's free to use. Anybody can contact me by email or by phone. We also have support groups and networks, including Paget's Buddy Scheme. So if somebody wants to talk to somebody else who's got Paget's disease, then they can do that. And of course, we've also got our membership services as well, so that people can keep in touch with what's going on at the Paget's Association and news and research.
Okay, thanks, Diana. I forgot to ask, actually, when we're on the topic of booklets, obviously stuff can go out of date, in medicine, there's a lot of changes. How do you decide how often to update them, and roughly, how often does that occur?
Depends what it is, really, because some information such as the leaflet about what the Paget's Association does, that doesn't really go out of date very much. But our facts booklet, that was reviewed when we had a guideline published. So if there's any significant new information, then the information would be updated. But otherwise, we just keep an eye on things and update things as necessary.
Okay, thanks, Diana. Now, you've been with the charity for 10 years, and Obviously, there's been a few changes in that time. What would you say the changes have been, or the main changes have been, and have they affected how we kind of provide information and support patients?
Yeah, I think the biggest change recently is development of online support, because particularly with the COVID pandemic, it forced us into doing more things online. So we now have virtual support groups, and these are supporting people all over the world. I think currently about 5 different countries, including America and Canada, are taking part in the support groups. So that's probably the biggest change.
That's amazing. But approximately how many people do you think are involved in those groups? I don't know. Can you give us an idea?
We've got about 45 people who are registered as interested in the groups. Each group meets every 2 months, but only about a handful of people will actually attend. What I found is that some people will come back every 2 months, whereas others will come, they will ask questions, and then they don't need to come anymore, which is absolutely fine. The main thing is that people get the information and support that they need when they need it, and we're there for that.
That's great. And I know that we have like a Facebook group. Is that more a peer-to-peer group, you know, where patients with Pagets talk to each other? Yeah, okay. So it's slightly different from the support group you're talking about.
Yeah, we've got about 700 people in the Facebook support group. And as you say, they talk to each other. And if they need support, we're there and we can jump in and offer support.
Wow, that's fantastic to hear. And we are quite a small organization, and it's amazing to think that with this technology, we can reach people all around the world. In fact, I did an interview with Sue Clegg, who is the administrator, and she said very much the same. That was the big change. Now, is there anything else you do for the Pagets Association? You mentioned the magazine. What's that about?
Yeah, we have a membership, and so we produce 4 magazines a year for our membership. So these are just examples. It contains information about Paget's disease, research, fundraising activities, and also details of our information events and our support groups. It's really good for just keeping up with what's going on. And of course, we also raise awareness through external events such as exhibitions and conferences, and of course, Paget's Awareness Day as well. Okay,
Diana, thanks very much. You are a busy person, I can tell that. Look, thanks for sparing the time to talk to me, how much you do and the association does for patients with the disease. You really are a powerhouse of information, I know, and support. And thanks once again.
Thank you.